Good to be with all of you again. As expected, we're seeing COVID rising across the country this winter. And while COVID isn't the disruptive force it once was, we are focused on ensuring that the U.S. is prepared for this winter, no matter what the virus throws at us. As you know, we have the tools, we have the infrastructure, and we have the know-how to manage this moment. And that means protecting people, preventing hospitalizations and deaths. And the key is this: we don't want this winter to look like last winter or the winter before. And our winter COVID-19 preparedness plan helps us do just that. So how do we do that? First, and you're not going to be surprised to hear me say this, the most important thing Americans can do is to go get their updated COVID-19 vaccine right away. Now, you heard this from Dr. Fauci just before Thanksgiving. You heard this from me. And I will repeat again, the updated COVID-19 vaccine is your best protection against the version of COVID we're fighting right now. Second, a critical component of our winter plan is making it even easier for Americans to access the tools that will protect them this holiday season: vaccines, tests, and treatments. So let's talk about tests. Today, we're opening up covidtest.gov for a limited time this winter to give Americans another easy option to access testing when there's a greater need, as there is right now. Starting today, each U.S. household can order up to 4 at-home tests free from covidtest.gov, with tests starting to ship as early as next week, the week of December 19th. And as we've said for months, we're operating in a resource-constrained environment in the absence of additional congressional funding for the nation's COVID response. And that means we've had to make some tough choices. Like in the summer, we were forced to suspend the covidtest.gov program so we could preserve our tests. Why did we want to preserve our tests? Because we knew there would be a moment later in the year when COVID cases would rise again. So we preserved the tests so we could have them on hand for exactly this moment. And if we don't get more funding, we won't be able to send more tests out to the American people. Next, we're standing ready to support states and communities with medical personnel, supplies, and other resources, as the president has been committed to doing since the first day he took office. Today, Secretary Becerra is sending out a letter to all governors underscoring that our partnership with state and local leaders has been essential to fighting this virus. But the Secretary also made clear we need them to step up right now to get ahead of this increase in COVID that we are seeing across the country. And he outlined all of the federal supports available to set up more vaccination sites, more pop-up clinics to get more shots in arms, to expand test-to-treatment programs, including new test-to-treat programs, sites that the federal government can help with, to make key supplies like at-home tests widely available, and things that the federal government can do to support hospitals and health systems as needs arise. Because the bottom line is this: we're all in this together. Fourth, we are accelerating our efforts to protect the highest risk Americans, building on the considerable steps we have taken. Now, I want to remind everybody that more than 90% of COVID deaths in the US have occurred in people 50 years of age or older. And in recent months, we've seen COVID deaths really concentrated among those 65 and above. And while we've seen many older Americans step up and get the updated COVID vaccine, there's still too many older Americans who have not gotten their immunity updated, who have not gotten themselves protected. Under half of nursing home residents have gotten their updated COVID vaccine. So we are working very closely with leadership of nursing homes across America, and we have asked them to step up to do more. We've developed a winter playbook for nursing homes and long-term care facilities to help them take action, to make it easier to get vaccines on site in nursing homes, to make sure that treatments are available on site in nursing homes, to improve indoor air quality, another strategy that can make a really big difference. And we are reaching out to governors where nursing home vaccination rates are low to offer personalized support. Now, before taking your questions, let me close with this. We don't want this winter to look like last winter or the winter before. And it doesn't have to. What's different is that we have an updated vaccine that targets a version of the virus we're fighting. But we need people to get that vaccine. It's free and widely available. what's different this winter compared to last winter is we have highly effective treatments that are widely available if people get sick. But obviously we need doctors to prescribe them, we need people to get them. This winter, we can keep people safe. We can prevent hospitalizations and deaths, we can minimize disruptions. The administration has been planning for this moment. We are doing our part. We're prepared. But the bottom line is we need other leaders to step up as well. Governors, mayors, people who've been terrific partners throughout this entire pandemic. But here's what I know. If every American does their part, if every American goes out and gets an updated vaccine, if every American gets treated who's eligible for treatment, we can have a very different winter ahead. And that is a goal of this effort. So with that, let me stop, take questions, and KJP, I'll turn it back to you.
Thank you. Dr. Jha, moving out from the U.S. borders for just a second, certainly one of the risks that faces this nation is additional spread from a big outbreak in China. Can you give us a sense of whether the U.S. government was aware or made aware in advance that Paxlovid would be made available in China? And can you give us any sense of what talks are happening behind the scenes, to help get Western vaccines and medicines to that country?
Yeah, so on the specific question of Paxlovid, the U.S. government was not involved in any way, and it was, so really refer you to Pfizer, but we were not involved in that in any way, shape, or form. On the broader question you're raising, Jeff, what I would say is this, and since the beginning of this administration, the president has been very clear that we think it's really important for the world to benefit from the fruits of American scientific innovation. We have been the largest donor of vaccines in the world, almost 700 million doses, many bilateral, many through COVAX, and the president's been very clear. We stand ready to help any country that needs help in terms of vaccines, treatments, anything else. So that offer stands globally for any country that could benefit from it.
Would it be fair to characterize this as the U.S. and other Western countries are encouraging China to import mRNA vaccines, but not necessarily with U.S. or strong U.S. involvement? Does that give them cover that they need?
No, what I would say is we stand ready to help any country in the world with vaccines, treatments, anything else that we can be helpful with. We have been the biggest donor of vaccines, as I said, almost 700 million doses. And that stance of being helpful, being ready to help, continues and hasn't changed.
Dr. Jha, looking at the most recent COVID numbers we have, it looks like COVID cases were up 45 or 50% week over week last week, but COVID deaths were up 60%. Why are COVID deaths spiking more dramatically than COVID cases are?
Yeah, it's a good question. So some of that is, by the way, data irregularity. Just to be clear, the data is we're in a different place with data. We get data less often. So in general, we have seen COVID cases go up. We've seen hospitalizations go up. Deaths are just starting to rise. I do think that standard link we've seen between cases and deaths are going to be different because there's less testing. So it's going to be later to see cases go up. But so far, nationally, in our analysis of the data, death numbers are just beginning to rise. We obviously want to make sure that does not go any further. We know we can prevent nearly every death from COVID if people get their updated vaccines and people get treated. So we continue to press that message.
And are you considering a return to other restrictions, masking on planes, vaccine requirements?
Yeah, so I think we're in a very different place with this virus and where we were 2 years ago, where we were last year. What I would say is we now have the tools that we can manage our lives much more safely than we could a couple of years ago. And the most important thing I think people need to be doing is, first of all, they've got to get their updated vaccines. And then there's a whole host of tools that people can use to keep themselves, their families safe, testing, masking, improving indoor air quality, being in better ventilated places, and treatments, of course. So we think that is the strategy of the administration, that we want to encourage people to use those tools, and given how widespread and how available those tools are, I think if people did that, we could get through this winter safely.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.